Okay, so a little secret for you. Muscles are dumb. What does that mean? Muscles are dumb. It's like, okay. Well, let's think about like how the role of the muscles work in kind of the whole body system. So I have this impulse to move that usually comes from either a conscious thought or an unconscious thought. That's something my body's just doing for me. And we ask it to do something and the muscle either lengthens or it shortens. Cool, that's pretty easy. And I'm saying this only because so often we're like, it's that muscle and that's the muscle that's doing this to me and blah, 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 blah. It's my piriformis. I'm like, okay, cool. Why would your piriformis be doing that? Because they only do what they're told to do and they're pretty dumb, so they follow directions. Like they shorten or they lengthen or they just hold or they don't fire. That's pretty much it. So rather than like blaming a muscle and trying to figure out like, well, why? It's more, why don't we take a look at it and figure out like, well, what's maybe causing that? So there's all these theories about like trigger points and referral patterns and all this other stuff, but it's like if you have a tight piriformis, like maybe there's something that's going on that's driving that symptom and that's telling that piriformis to like clamp down and hold tight and don't let go. What do you think about that? Like that's how I want to look at movement, and that's how I want to like look at the body and pathology, and that's how our therapists do too. It's not just the what is it, like that's a fun game and all, but it doesn't get us to an answer and doesn't help necessarily resolve the problem. Whereas if we look more like, well, gosh, if that piriformis is lit up, I know that if we got a back thing that it'll kind of throw some symptoms down there and it can turn that muscle on in like a really guarding way, and that'll make it really tight. Tight muscles, or sometimes just nervous system putting the brakes on us, to be honest. Or there's some sort of pain response, so everything's kind of like just holding down. So why don't we just try to remove the pain and maybe that symptom will go away? Instead of like peeling layers down all the time from the outside, why don't we think about kind of going from the inside out? So let's start deep. Let's go spine. Let's go disc. Let's go nerve. Like let's go like those kind of central things, and then we can kind of work our way out. Sometimes that can also be because through like a muscle imbalance. So if we look and we go, oh, okay, that piriformis is doing a lot. It's like, well, is your glute working? Is your core working? Is one muscle just like, okay, I got this, guys, I'll help and I'll hold on. It's like, that could be it too. So it's really something that we have to figure out from a much larger global perspective. Why are you having the symptoms that you're having? And again, what could be driving that symptom? Not just like, hey, that muscle's tight, or like, oh, the favorite is like, oh, these upper traps are really tight. It's like, yeah, you know, sometimes I'll tell you what, more people use their upper traps to breathe than you would even imagine. And I know that sounds crazy, but it's true. And more people have weakness in all other kind of muscle groups around the shoulder, that if the upper trap's the only thing working, of course it's going to be pissed off and angry and holding and like just trying to hold your head up maybe, which isn't its job. Its job is not to do that. So now it's doing somebody else's job. It's not happy about it, so maybe that's why it's sore. So we have to look at this rather than just why is that specific muscle tender or sore, or why does it have a trigger point, or the fact that it has a trigger point, and try to figure out why it has a trigger point. So that's where we come in. We do a full evaluation. We start to kind of see what we can find, whether we go down through your spine, check out your shoulder, like are things moving the way they should? Functionally, can you push, pull, carry, lift? Can you squat, lunge, hinge, and do all these other things? And can you do that in a coordinated, patterned way? Do you have some really easy to find impairments, or are there some that are pretty deep in that we have to like really pull a bunch of layers back and try to find them? Either way, there's usually a reason for these symptoms, and sometimes just, you know, poking on it or pressing on it or rolling on a lacrosse ball or something like that, it just doesn't take care of it. We have to fix it from the root cause. Otherwise, stuff comes back, even if it feels better. So again, muscles are pretty dumb, but thankfully they do what we tell them to do. And if we can get them to chill out and we can do kind of like a nervous system reset and then reload a good movement program on top of it, we're in pretty good shape. So if you have any questions about that, or it's something that you'd like one of our specialists to help take you through and try to find the root cause of any of your complaints or your issues, give us a call. That's what we do. We'll take care of you.